Before we continue, I want to remind everyone that during the Q&As today, we ask that you post your questions in the Q&A window, which you can access at the bottom of the Zoom window. Or you can raise your virtual hand and we will do our best to call on you to ask your question. We will unmute you when it's your turn. I should also mention that for those of you who are among the first 100 people to join the sessions today and the last 2 days and stayed for the duration of those sessions, you will receive a wellness credit in the mail in the coming weeks. Now, as Tammy has mentioned, it's time for what we're calling the reality check. What impact has COVID-19 had on employment in Canada? We will have a Q&A after all 3 presenters have finished today. Our first presenter shared her insights into the dynamics of disability on day 1 of the summit, and we are so pleased to have her back today. Gail Fawcett is a senior research advisor at Employment and Social Development Canada. She designs and conducts research on persons with disabilities at ESDC, primarily using data from Statistics Canada to support program and policy development in the department and in connection with Canada's reporting requirements for the United Nations Convention on the Rights of Persons with Disabilities. She's been involved with this type of research for nearly 30 years. Welcome back, Gail.
Sorry. Thank you, David, and thank you to everyone for having me back again. I'm going to be giving you a little bit of a data overview on what we have, the data that we have, what we lack, and what we're going to be getting in terms of understanding what's happening to persons with disabilities during COVID. Can we go to the next slide? Yeah, I'm not operating the slides myself, so I'm telling somebody else to advance them. That's great. So a part of what I wanted to do was really give everybody a resource with respect to the kinds of survey data and data gathering efforts for persons with disabilities, and also a whole lot of other resources and links that you can see in the back. We're not going to go over all of that today, but I wanted you to have that kind of a resource. So first of all, the only representative data survey data source that we have that's nationally representative on persons who experience disability dynamics actually comes from the 2017 Canadian Survey on Disability. And for those of you who might have been here on Tuesday, I went into a little bit of the results, but it's actually very difficult to identify persons with various types of disability dynamics. It's not as simple as an on again, off again pattern. There are a lot of complex conceptualizations that have to go into a survey definition. It's like disability itself. It's not something you can get with a simple, quick question. So that's a little bit of the challenge in terms of gathering data that's nationally representative. And it's also maybe why some of the qualitative and sort of smaller area studies are extremely useful at helping to fill in a lot of those gaps. So you can see in the appendix a full list of the surveys that contain Canada's disability screening questions, which we call the DSQ for short. But on the next slide, if you could advance it, there are 3 that I'm going to quickly focus on. The first one is, of course, the Canadian Survey on Disability. We discussed this on Tuesday. One of the questions that came up was, why can't we do it more often? We can't. It can only be done every 5 years. It is what we call a post-census survey, which means it requires some information that is on the census to build the sampling frame. So the next one will be in 2022. And as I mentioned on Tuesday, we have really improved the questions around episodic disability so that we'll be able to identify a number of different kind of groups within those people who experience dynamics. And we'll learn a lot when it's released, but they're not in the field for another year. But we will be capturing possibly some of the impacts of COVID. The other survey that you should know about is the Canadian Income Survey, the CIS. It's conducted yearly since 2013. It's had the disability screening questions. Unfortunately, there's like a 2-year time lag from the time that it's done until we actually get the data. It's cross-sectional, which means it's different people every year. So we can't sort of see that longitudinal what's happening with them. We will be getting data from this survey. We don't have it right now. Most recent data we actually have access to is 2017. It's a bit delayed because of COVID. So the other data set that you should know about is the longitudinal and international study of adults, which we call the LISA. This is the same people, so it's one cohort. They're followed up every 2 years. There is the DSQ, the DSQ is on that survey. And hopefully someday we'll be able to see what happened, because they were in the field during 2020. So they were actually in the field during COVID. So, but we don't have those data yet. So, okay, so what, if you could just go back to this, yeah, that one, thanks. So what do we actually know then about persons with disabilities? We have a lot of really good studies that have been done from qualitative and small area studies, but in terms of a national, something that's representative to the population, what do we actually have? Well, we won't know what's happening from the 3 surveys that I just told you about for another couple of years at least. And StatCan, though, has been trying very hard to gather data. One of the things that they did immediately was they started running crowdsourcing surveys very, very quickly off the mark. They're very quick surveys. It relies upon people to voluntarily go in and answer the questionnaire. They're not necessarily representative of the population, so you would never, for example, get the rate of persons with disabilities from a survey like that. They're much better at giving you an idea of some of the relationships and some of the issues that are facing people. So they have been doing that. I've got a link here on this slide, and you can. They've been publishing about all different populations. Some of them have been about persons with disabilities. So that link should be handy. And then if we can go to the next slide. So one of the key instruments that Canada's had in terms of understanding what's going on with during COVID has been the labor force survey, and the labor force survey is conducted every month. We get monthly data, and it is our primary survey for really understanding what's happening in our economy and to our labor market. People, when you go into the labor force survey, you answer every month for 6 months, and then you rotate out. The Canadian Income Survey that I mentioned earlier is a supplement of that survey. So those people who are rotating out of the labor force survey are given this other survey to follow up, and that's the Canadian Income Survey. So the labor force survey, unfortunately, does not have the DSQ to identify persons with disabilities. And this was one of the big issues because it identifies a lot of the other groups. And so we knew how other groups were doing, but we don't know how people with disabilities are doing because it's not on that survey. But Statistics Canada has developed a technique where they're going to take the Canadian Income Survey, model it back to the labor force survey, and provide us with data. So what we will be getting at some point in the coming months will be a look at what was going on with people with disability in January and February of 2020, just before COVID really hit. And then what was happening sort of towards the end of the summer from July through September. And then again, they will do the same thing for the current period, like January and February of this year. So over time, we'll be getting these little things that we can monitor. So when that comes out, we will actually have some good representative data, but it's not out yet. So, but this is just an example of the kinds of methodologies that we've had to, that we've had to go with to really try to make sense of something that's happening very, very rapidly. So if you could just go to the next slide. Jacob, the next slide, please. Okay, so okay, I think you might have skipped us. Maybe you skipped a slide. Sorry. Yeah. Yeah. So we know that. So what we can do though right now is we can piece a few things together. And sorry, sorry, Jacob. Let's go to the next slide now. So we do know, for example, as of 2017, we've got very good data on persons with disabilities and persons with episodic disabilities. And so we know, for example, that 80% of persons without disabilities, 20 to 64, the kind of prime working age, 80% were employed compared to 50% of persons with disabilities. For anybody who was listening on Tuesday, if you look at the various groups, if you look at those who have continuous, in other words, the stereotypic disability that's there all the time, that is actually the minority of people with disabilities, but nonetheless, they have closer to about 60% employment rate. Then you see about a 50% employment rate among those who have fluctuating, that sort of up and down, hard to predict pattern. Those who have progressive disabilities, they're even down around 43%. So we know from that employment rates are very low for this particular population. So we also know that youth, particularly youth with episodic disabilities, are a lot more likely to be experiencing difficulties in their transition from school to work. So we know that. If you could go to the next slide, Jacob. Yeah, so we also know, for example, that persons with disabilities are overrepresented in the particular occupations and industries that have been most impacted by COVID. And we know who's been most impacted from the LFS. We also happen to know the profile of persons with disabilities. For example, for men with disabilities, they're a lot more likely to be working in, let's say, support services, janitorial, laundry, security, waste management, whereas men without disabilities are more likely to be working in sort of professional, scientific, technical services, a lot of the types of occupations that are amenable to working remotely during flexible work arrangements. So that's not good news for especially men with disabilities. But we also do suspect that it's going to be women with disabilities, and that's been echoed before, who will have the most difficult time, because women with disabilities are much more likely than even their male counterparts, but certainly women without disabilities, to be working in retail trade I'm stumped for the word. Accommodations. Oh God, it's gone right out of my brain. But they are much more likely to be working in the areas that have been most affected. They are also more likely to be, for example, in hospitality and accommodations. Sorry, yeah, if we could just go to a few slides. The next slide, Jacob. Okay, these are just some helpful links for you. So let's just go to the next slide. Okay, so we know, for example, that youth and young women are more heavily among the low income earners, the more vulnerable workers, those who are in less secure occupations, often working in hospitality and accommodations. That should be retail trade, not retained trade, sorry. And we also know that they're overrepresented in the care sector. And this has two implications. Although their jobs may be in higher demand, they are also perhaps more likely to be at risk of catching COVID as a result, and they may have compromised immune systems. So that's putting them in a much riskier situation. So the one area that they are concentrated in is also an area that is incredibly dangerous. So, none of this is particularly good news. We also know that certain intersectionality, women with disabilities, youth with disabilities, racialized persons with disabilities, all of these are most likely to be negatively impacted because of where they're working. We also know from previous recessions that have happened that persons with disabilities have a long history of being first fired, last hired. And if we could go to the next slide, Jacob. We know, for example, we've got some evidence, and you can see some of the links down there. We know that a recession that occurred in the early 1990s, it was women, particularly young women, who lost employment very, very early on, and they regained it quite a bit later in the decade. In fact, by the end of the decade, they had not really fully recovered, whereas everybody else had. So we know that those with lower levels of education, marginal employment, are also going to be negatively impacted. If we could just go to the next slide. I see David, and that means I have a minute left. So, and also Tammy mentioned the long haulers, and there are a couple of references there. The one thing that, you know, I've been noting about the long haulers is the description of it sounds very episodic, and I suspect that, you know, this is going to be a huge challenge in the future. We don't know how big. I'm hoping when the 2022 CSD comes out that we'll have some indication. Maybe we'll be able to identify people who are in that situation. If we could go to the next slide. So I guess the takeaway points are we have very little direct data, but we've got new data coming out and innovations that are happening. And in the meantime, we do know that people with disabilities for this particular economic crisis are working in all the wrong places. And we also know that it's wrong places in terms of job loss, but wrong places also in terms of high risk. And we suspect that women and youth and young adults with disabilities are probably going to be the most heavily impacted. And I think that's probably the end. Could you go to the next slide? Okay, so this is just a list of resources where we can identify persons with disabilities, and not necessarily episodic, but and then if you go towards the end, there's some more references that might sort of give you some ideas as to just what could be happening. So that's it.
Thank you so much, Gail. You know, it's really sobering information that you've given us here, but it's so important and so vital as we plan our next steps. So thank you again. Now, I would like to call on Dr. Michelle Lee Maroto, who is an associate professor in the Department of Sociology at the University of Alberta, and Dr. David Petanicchio, who is an associate professor in the Department of Sociology at the University of Toronto, Mississauga. Drs. Maroto and Dr. Petanicchio and a research team of PhD students are working on a project focused on COVID-19, disability, and chronic health based on a national survey and qualitative interviews. 2 peer-reviewed articles based on this work are already published in the Canadian Public Policy and the Disability and Health Journal. Welcome, Drs. Maroto and Dr. Petanicchio.
Oh, thank you, David. Thank you so much for having us here today to talk about this project. And today we want to talk a little bit about some of our research on COVID-19, employment and economic insecurity among people with disabilities and chronic health conditions. And we're definitely excited to share some of our findings from this project with you all today. So can you jump ahead a slide? Thanks. So just to give you a little bit of an outline for the talk for today, I'm going to start with a little bit of a brief background on our project. Then I'll talk more about study design and methods, and I'd like to spend most of the time talking about some of our findings today overall. So if you want to go to the next slide. All right. So before I get to some of the findings, I want to start by grounding this particular study. Now, for over a decade, Dr. Petanicchio and I have been studying stratification in relation to disability status. And our research has covered a lot of different areas, from employment discrimination to poverty and economic insecurity to credit market access and to housing. And at the beginning of the pandemic, we were seeing a lot of stories and a lot of headlines like the ones I have up here on this slide. And I know it's a bit messy, but I've included a lot here to show just how often we've been bombarded with many of these stories throughout the news media. But overall, we saw stories about how people with disabilities and chronic health conditions were more at risk for contacting COVID-19, for ending up with complications, and from dying from the virus. Now, with all that, we also saw stories indicating that the supports provided to people with disabilities were not enough. We saw stories describing how many kept working even with the increased risks. And we saw articles noting how overall there was a lack of data on people with disabilities. And in Canada, for example, people with disabilities were really overlooked in early COVID-19 relief funding. So the primary financial support in Canada has been the Canada Emergency Response Benefit, or CERB. But this taxable $2,000 a month subsidy was targeted to those who lost employment during the pandemic. It didn't consider the struggles of people who weren't employed before the pandemic even began. And in this case, in the case of people with disabilities and chronic health conditions, a large percentage of this population wasn't employed before the pandemic. And later on in the pandemic, the government did add in a small amount of targeted support for people with disabilities, but this was still pretty limited. So building on what we already know about increased economic insecurity among people with disabilities and the many barriers that they face within the labor market, we decided that we can make a contribution here with some additional research. So if you go to the next slide, the research that I'll be discussing today comes from a study that started to come together in April of last year at the very beginning of the pandemic. And the broad research question underlying the whole project has been, how are people with different disabilities and chronic health conditions managing under COVID-19? And within this, our project focused on 5 key areas. We looked at individual responses to COVID-19, aspects of economic insecurity and employment, education, mental health, and people's overall perspectives on the government response to the pandemic. Now, today I really want to focus on the employment area and think about 2 questions here. So what is employment, or a lack thereof, meant for the economic situations of people with different disabilities and chronic health conditions during the pandemic? And among employed workers, how has the nature of their work changed, and what's really their future outlook on their employment situation? So if you'll go to the next slide. And the findings that we're going to present today come from a mixed method study that we undertook last year. And this mixed method study included a broad integrated plan for collecting both quantitative and qualitative data from the beginning. So we really wanted to get at both breadth and depth in relation to some of those areas that I just listed, and mixed methods were really the best way for us to do this. So our study overall includes an online quota-based survey of about 1,000 respondents that we conducted in June 2020. And we also invited all of our survey respondents to participate in follow-up interviews. We then, with our team of research assistants, conducted 50 interviews from August through November of 2020. In terms of participants, we include people with a broad range of disabilities and chronic health conditions. And we do this in order to capture some of the varied experiences of this large and diverse group. So our disability-related questions, which were built on the 2017 Canadian Survey of Disability questions, these allowed respondents to indicate the severity of their disability, and they asked about hearing, vision, physical, cognitive, emotional, and other functional limitations. And we also asked about the presence of 9 chronic health conditions that put people at a higher risk of developing complications from COVID-19. Now, because we really want to focus on findings today, we won't go into too much detail about study design beyond this. However, we do have a link to a methodological appendix for those of you who want to learn a little bit more about our study. And I can share that with you at the end of this talk as well. So if you can jump to the next slide. Now, in terms of the findings that we're going to share today, we want to focus on a few outcomes to give you a good overview of how workers were doing last year. And here we're going to include some results from our survey data, and we're looking at the outcome of worsening financial insecurity. So this indicates if the respondent reported that their household's financial situation was worse in 2020 than it was in the previous year. And we also want to look at how this is connected to employment status among our respondents. So is employment influencing whether or not people experienced worsening financial insecurity during the pandemic? Now, to build on this, we're also going to include excerpts from our thematic analysis of interview data. And these are going to discuss respondents' varying levels of employment security and their changing employment situations as well. All right, can you jump to the next slide? Okay. Now to get to some of our findings. Well, as I mentioned earlier, many respondents with disabilities entered the pandemic without employment and without federal COVID-19 related income supports like CERB. And at the time of our survey, 48% of respondents were employed in full or part-time jobs, 4% were unemployed, 48% were not in the labor force. And this is a large category that included homemakers, students, retired persons, and people who were unable to work specifically due to COVID-19. And in total, 9% of respondents reported that they were unable to work due to COVID-19. So that's the employment situation. Now I want to tie that to people's experiences of financial security or insecurity. And this graph up here is going to highlight that relationship a bit here. So the figure we have up here shows the proportion of respondents who reported worsening financial situations. And this is broken down by their employment status. So on the y-axis here, so if I had these slides here, I'd be able to show you with my pointer. But along the y-axis, we have our different categories of employment status going from employed full-time to part-time, to people who weren't working but were looking for work, to people who weren't working but were homemakers, to those who were in school, to those who were retired, to those who were unable to work due to COVID-19, and those who are unable to work for other reasons. And then along this, we see these little points with bars going through them. So the points indicate the probability that a person in that category reported a worse financial situation in 2020. And those bars that go through them give us an estimate of error around those estimates. So if we look at this figure, we can see that certain groups were doing better than others. Those who were employed full-time, part-time, and those who were homemakers or retired, about 33 to 35% of them experienced worsening economic insecurity. Now let's compare that to unemployed respondents, respondents in school, and those who are unable to work due to COVID-19. And in this group, about 55 to 70% of them experienced worsening financial insecurity. So our findings here show that unemployed respondents and those who were unable to work due to COVID-19 reported worsening financial situations, more so than other groups. And although employment helped to improve respondents' financial situations, many of the employed respondents still also felt various types of insecurity. So employment didn't save people from insecurity. It helped, but many of those who were employed were still really concerned about losing their jobs in the upcoming months. And this varied across occupations and job types. And this is something that our interview data highlights really well, I think. So in the next slide, we can think a little bit about income losses for those who were employed. So our interview data really shows the changing situations of employed respondents with their working conditions. And one of the things that became really apparent was that many people kept working, but they also experienced income losses. And this is highlighted in a quote from a participant, Glenn, who was a 46-year-old respondent who reported vision, hearing, and emotional disabilities, as well as a heart condition. He says, boom, because what happened is when we got back, they pretty well spun on us that we were getting paid minimum wage and very little commission. Because before then we were getting paid commission. I lost pretty well 75% of my income. This is how Glenn described his return to a sales job in a furniture store. He was facing a great deal of uncertainty as furniture manufacturing slowed, and his company started shutting down branches due to lower sales. Now, although he remained employed, Glenn was earning a much lower income, and he was also relying on CERB to help make ends meet. This definitely took a toll on his financial situation. He further explained to us saying, when you see your bank account dwindling here and it's not increasing, you just try to figure out and find, okay, how many more months can I keep doing this? Other respondents that we talked to described similar situations where the pandemic affected their job stability and income. However, I do want to note that this wasn't the case for everyone. So if we can go to the next slide, we can see that across our interviews, we found that government employees and unionized respondents appear to have much greater protections, which actually mirrored some of our survey findings as well. So for example, take this quote from Jean-Marc, a unionized government employee who has severe anxiety. He noted how a good job allowed him to continue to work, contributing to his sense of security during the pandemic. He says, yes, I'm fortunate really. I know, but I'm very grateful to still be employed, and I did not have any effects in my daily job with COVID. So I've been employed since even after COVID and still with my full paycheck, and I'm still working the same hours. So yeah, we're unionized. So in our convention, our collective bargaining agreement, we'll probably also have a very small raise this fall. So this is a very different situation than that of our previous participant, Glenn, who was facing much more insecurity in his job situation. So the type of the job and whether or not it was unionized really mattered for participants. Now, if we can go to the next slide, I still want to note with all of this that even the more secure workers did report changes to work more generally. So the largest change experienced by more than half of employed respondents was a transition to working from home. And this option was far more readily available for workers in management and administrative jobs than for those in the service or retail sectors. However, even those who were able to make this transition to a safer work from home environment, about a third also reported increased work hours. And this brings on other added stresses as well. And I think the second quote from Jean-Marc again really illustrates this point pretty well. He says, yeah, well, the first thing is that I'm not working at a workplace anymore. I'm working at home. I'm still working the same hours, but I would say that during a certain period of time, I was working more hours than I did not charge my employer. Because I thought, well, I was just lucky to still have a job, so I did not charge those hours. So even in his more secure situation, Jean-Marc still ended up working extra hours, which can contribute to stress and anxiety as well. All right, and if we go to the next slide, just to summarize a little bit of what we shared today, overall, we know that COVID-19 is really accentuating a lot of pre-existing structural disadvantages and inequalities. We can see this in basic data on rates of infection, hospitalizations, unemployment, and accessing government benefits. And this is clearly the case for many groups. With all of this, we also have evidence showing that people with disabilities and chronic health conditions are among the most vulnerable to COVID-19 and the most affected by the strategies that are taken to combat the spread of the virus. So this makes research like this study so important as we continue to still muddle our way through the pandemic. And I think this presentation really just presents a brief snapshot of findings from one of our few surveys on the effects of COVID-19 among people with disabilities and chronic health conditions. And here we try to highlight the importance of employment for continuing economic security. But we also want to note that employed workers still face certain challenges during the pandemic. Even among those who kept their jobs and remained employed, the pandemic has really changed the nature of work in many ways that can exacerbate and expand inequality. All right, so I think there's one more slide and just a thank you slide. We really appreciate you having us here, and we look forward to questions and discussion after this.
Thank you so much, Dr. Maroto and Dr. Pedanicchio. We'll be following the progress of your project and how it can inform our work as we move forward. Now we will open the room to any questions. Melissa, I'll hand it over to you.
Thanks so much, everyone. Wow, that was amazing. And it's always really nice to hear about what kind of research is happening and how it's working. So I have 3 questions in the Q&A box. So if anybody has anything exciting that they'd like to ask our presenters, please throw it in the Q&A box or raise your hand. The first 2 questions are for Gail. So the first one is, how do policy and decision makers develop or design programs to support employment for people with disabilities with limited data?
Okay. With great difficulty, with fear, but we do. As soon as COVID hit, like in mid-March, when the lockdown happened in Ontario, I'm in the National Capital Region. So when that happened, the very first thing was you get together a deck on what do we know, what don't we know, how can we know it, and who's going to be most affected. And so one of the things that we did, we went back to data going back to the 90s, looking at the impact of various different economic crises, because we knew that there would be one. And we did an analysis of the early 1990s, the 2007 to 2009 crash, and we looked at how persons with disabilities, and we pieced together the bits that we had. We had a pretty good run of data through the 1990s. We had another good run from 1999 to 2011. And then, we had what we had from the early, 2010s. So we pieced that together a little bit the way I did. Modeling takes part, has a role in all of this. Where do they work? So we were able to figure out exactly where, people with disabilities and different kinds of different disabilities and different groups within that, where they tend to work. Is that where, job losses are happening? So, and then StatCan, did some crowdsourcing. We looked at what was going on in other countries. Basically, we just scoured everything we could and tried to make sense of it. There was, in the throne speech back in September, it was announced that, they know that, we need to do a new benefit for persons with disabilities. And a lot of it is trying to figure out, how best to do that, who's getting left out. But I've got to say, I loved the presentation, Michelle, that you and David just did. It's exactly the kind of thing that we desperately need right now, because I'm a big fan of the marriage of qualitative and quantitative research. And we tend to do a lot more of the quantitative research, but I really, when you find out how, just exactly what's going on, the process that a person is experiencing, that really helps you figure out sometimes just exactly, what decision makers need to do. So all the work that you've been doing, all of the work that others have been doing during the pandemic has been really valuable. And a lot of it is trying to get as much of that as we can, because that really shines a light on the reality of what's going on. So then the next one I see is, so yes, I don't know, we do our work for our policy colleagues and our, the people kind of upstairs. Where they take it, I don't know. I do know that we some of the work that we've done is actually on StatCan's website, so it is pretty. And we do have various contacts throughout, but so it does get shared. And one thing I would really encourage you to do is to take a look at StatCan's website for for all of the things that are being published. And it's a really rich resource. But I love this last presentation. It was just you sort of put the words to exactly what we figure is going on. That's exactly what you're finding, and that's incredible. And there's a real value in being able to put those things together. So that's a great job. Thank you.
Thanks, Gail. The next question is probably pretty brief. It's for Michelle and David, and it is, how did you select the participants for your particular research study? Were they from different provinces? Could people volunteer or ask to participate? How was that selection process done?
So for selection, we started with our survey, which we used an online survey research firm to help us contact participants. And we wanted to make sure it was representative across Canada, so it's proportional to the size of the population in each of the provinces. I can leave you with a bit more details if you want to look at that appendix that there's a link for, because we did a lot to try and make sure that it was representative in terms of gender and age and things like that across it. So people couldn't ask to participate. We approached them through a survey research firm. And then everyone who participated in the survey was also invited to participate in a follow-up interview as well.
Okay.
And sorry, can I just add one thing?
For sure, yeah.
We also, the reason why that appendix is also important for those who are interested in this is that we compared our sample to the Canadian Survey of Disability. And so we actually do have, we have quite a bit of information about how our sample compares. So, you know, and the way that we thought about doing this was to sort of to consider both a rapid response, but also to make sure that we, you know, we had a sample that is, you know, reflecting the population as best we can with a quota sample. So, which is an alternative to, for example, how StatsCan did their crowdsourcing method, right? Yeah. And so all of that is also in that appendix.
Okay, that appendix that David is referring to is the last link that was posted by me in the chat. So if you're interested in finding that, that's where it's going to be. Unfortunately, folks, that's my time. I have to wrap up. But David and Michelle, there is one more question in the Q&A box. So if you've got a second, have a look at that. But for now, I turn it back over to David.